neuroplasticity is nothing but a concept which says that a brain or is a neuron, okay, let's leave brain, a neuron, right, has the ability to reshape itself or is reorganize itself. It cannot regenerate, but it can reorganize, which means it can adjust its pathway just to finish one task. So, if we look from a clinical perspective, if a patient is losing a function, okay, this neurons will create different connections from the good sides or as the good systems or as good areas of brain and will take over the task of this thing. Okay, now when your face is paralyzed, okay, when the power is absolutely grade zero, okay, one more thing, our brain, our face is also controlled by two centers. One is your analytical center, the motor cortex, right? And another is your limbic system, from where all your emotional abilities and everything comes into the picture. Now, what happens when a Bell's palsy patient lives before the Bell's palsy state? We rarely use the logical center on the face. Most of the time, all the expressions that we make or everything comes from your emotional center. Okay, it twists or else it gets opposite when there is Bell's palsy. Patient has this constant tendency of checking himself in front of mirror, whether I'm able to raise my eyebrow or not, whether I'm able to smile or not, over on the top of it, we give them this advice that you do more and more of face activity, more and more try to make your eyes close, smile as loud as possible, do chewing gums, blow balloon. All of these tasks are not natural tasks. It's not limbic system, it's your motor cortex. Now when the face is absolutely paralyzed, is in zero power, what you do, you are limiting this first place, right? You are totally dependent on your motor cortex. Now the motor cortex task is what? This is very straightforward and analytical. I want to raise my eyebrow. This is what the command which is coming. Now since the this thing is not happening, what the face does is it will use all the muscles to use and create that one single movement. Even though it's not happening, it will constantly fire. Now just imagine if the same process continues for 3 months, 4 months of time. This brain has overpowered this brain. Limbic system use has become very limited, and this has become the dominant part now. Okay, now this is because of neuroplasticity. Okay, now this leads to this habit and subconscious habit that no matter small movement or big movement that I do on my face, it will come with all the facial contractions only, or else mass movement will only happen. And what is mass movement? Sin kinase is the most devastating complication of Bell's palsy. All right, so neuroplasticity is a reverse phenomena, so we have to use the reverse phenomena of neuroplasticity when it comes to Bell's palsy management. But yes, in stroke rehabilitation, where we are working on our limbic, we are not dependent, so like we don't use limbic system for hand bending, right? We use our logical center, so there it really works well. In CP also it really works well, but here face is a bit complicated. Time therapy needs to be followed in a way where the exercises, we don't give exercises to patients, okay, we give expression practice to patients. So for example, if you have to give patient encouraging movement for eye, okay, like a blink or else this has to be improved, okay, so instead of saying blink 10 times, you have to ask patient to look front and ask him that imagine that you are standing in front of a pole which is very tall. Okay, and you are amazed seeing at that pole how big it is. Okay, so your way of see, if I tell you look up and down, it would be just like this. Okay, but when somebody is asking you to imagine something, it changes. This what I did has a difference. Okay, here the idea is the same, that you work on your limbic system, which was kind of has become little less dominant compared to your motor system, and allow it again to come back to the normal. So that's how you work on the mind therapy principle, basically. Same way for, say, eyebrow raise. So your eyebrows and eyebrow raise is again a voluntary task, but you ask patient to think of situations where you feel surprised. Imagine yourself getting a gift. Your expressions would be different. Okay, so you mind therapy is basically putting you or putting yourself in a situation, thinking how you will express yourself in that situation and just trying to do it. So mind therapy or any kind of acting based therapy, no, focuses a lot on first using your body in harmony. Okay, so we have the tendency that whenever people exercise also they stop their breaths, they get stuck. That every patient you must have observed, they, whenever you are doing other exercises also, when you're lifting hand, they'll stop breathing. So that is something that has to be a beginning part in any therapy, that you first breathe normally, come to a relaxed phase, because until unless you're relaxed, you will not be able to do your right movements in the right way. That's why. Right. So if you read the PNF book itself, there is a very clear note written that combat therapy puts a risk of synkinesis in the patient. Hence, it should be used with a very much caution. Okay. Never ever use combat therapy or proprioceptive neurovascular facilitation if you get even a small hint that this patient might land up into synkinesis. Okay. Because here we are not only facilitating, we are resisting a movement also. Okay, so usually I use PNF only when patient, I have this assurance and clarity that this patient has taken his medications on time. Right. People who are lucky enough on whom the pressure was very less, no, they will show the sign of improvement in first week. Okay, and the first sign would be that blink has started. If they observe that, okay, eye movements are coming, this has started happening, that is a very good sign. This is an ideal case where you should use combat therapy. Okay, because you know that ski recovery, whatever is there, is happening in a proper, in a good way. There are very less chances of synkinesis here, so we can kind of start the facilitation process a little early. Okay, so combat is basically for facilitation, right? Facilitating movement. So combat should be used in facilitation stage only. Even though I use in synkinesis management combat therapy, but that comes in a very later stage. If you read the name of PNF, proprioceptive neuromuscular facilitation, right? What is proprioceptive? Is the sense of proprioception. Now in our face, the proprioception works from our touch sensation. It doesn't work from our joint position sense. That's why the therapy has to do with the fingers. Okay, because these are very minute, small, tiny muscles. Okay, second thing is neuromuscular, which means connection of nerve with muscles and facilitation. So I'll just give you a simple example. What we train patients in usual scenarios, you raise eyebrow, you raise eyebrow. Okay, ideally it should not be that. What we should teach them is how you are able to feel the proprioception of the muscle contraction happening. So if you place your finger above the eyebrow here on both the sides and then you try to raise the eyebrow, you will be able to feel the contraction of the muscles. Okay, this is what needs to be trained to the patient, that see, if you are able to feel this contraction and this is your weaker side, you are going to facilitate this stral movement which gets affected in Bell's palsy, right? So we need to ask patient to keep two fingers on the side of the nose and ask them to sniff and then hear that contraction is happening. They are not able to feel on this side. You just do this, you'll able to feel. Okay, there's a very small muscle which contracts,
Yeah.
right? That needs to be facilitated.